For those looking to progress their careers in implantology, I think everybody knows at some point you start placing implants, you learn how to place implants. We also know that when people reach a stage where they're losing all of their teeth, they're in full arch world. But what about everything in between? And people looking to progress from doing simple conventional implantology, working towards more advanced techniques like full arch. Where does sinus grafting come into it, and what should they be considering in terms of their clinical skill set?
Number one, we have to take into account that the large number of patients who walk into the clinics, they have missing posterior maxillary teeth, and many of those cases don't have enough bone. So what do? Do we extract all the teeth and give them a full arch if they need 1 or 2 implants? No, we need to know how to deal with the case, graft the sinus, give them a couple of teeth, and everybody's happy. Number two, for people who want to move on at some point into full arch, especially with pterygoids, zygomatic implants, or transsinus implants, you need to know how to manage with the sinus membrane, otherwise you can't do these techniques. And three, you have to have a good understanding of what biomaterials work well and in what situations, and how you work with those biomaterials to get the best outcome. And if you don't know anything about it, you try to do your sinus lift and use the wrong materials, you might not get the best outcome. I've seen cases who have had sinus lifts 10, 15 years after the surgery where the bone grafting biomaterials started going bad. There was bone loss around those implants and we couldn't figure out what, and then once we got in and we removed all the biomaterial that was still in there intact, we realized that some of it did heal and some of it had soft tissue around it. So even the biomaterial that we use is important. So we're going to be touching upon those 3 areas, and the delegates will know exactly what they will be dealing with in terms of bone grafts, how they will be dealing with the membrane of the sinus, and that will allow them not only to graft the simple cases, 1 or 2 implants, but also how to utilize that skill when they move their career further down the line with the more exotic implants.